of the Daily Guide here this morning. Ex-Batha Stock CEO, wife charged over 78 million Ghana cedis. That's for theft, we understand, according to the Daily Guide newspaper. There's also the talk about the Lightwave story, because Lightwave, in terms of their health information management system, they are clearing the air over the digital health system shutdown, which the health minister has been talking about. So you'd find details when you grab a copy of the Daily Guide. The Daily Graphic is talking about this. Refuse collectors are now threatening to shut down payments by November 7. And that story we brought to you on the Joy News platform, indicating to you how, the service providers are raising some concerns. We'll get to it shortly. Government also aims at stable currency, and that's according to the president. A new payment regime to clear road sector debt within 90 days. That's the assurance from the sector minister. But the Public Accounts Committee is commending the Mineral Investment Fund CEO for competence and reforms at this institution. These are some of the stories you'd find on the Daily Graphic front page. For the archives is talking about the Lightwave Health Information Management System, because it says that Lightwave contractor overpaid $30 million for no work done. That's according to the Minister of Health, Kwabena Mintah Akandoh. The minister has also been announcing some state-owned digital systems.
Is that really what he said? Did he say for no work done?
Well, you know the papers and how they can actually term some of these things. Minorities boycotting CJ vetting after a secret meeting, and no building collapse at Roman Ridge. Officials are actually clarifying what's been trending online, purporting to suggest that the building had actually collapsed. Tor ENI, Ghana are exploring some more partnerships, and fisherman jailed 10 years for defiling a 13-year-old girl. I mean,
that story was terrible.
Yeah.
That story was terrible. And you know what? Honestly, look, the fact that story didn't cause a national uproar shocks me. This is a story of a guy who, according to the police, caught a 13-year-old girl who he claimed had stolen 800 cedis from him.
Yeah.
Instead of taking her to the authorities or doing one of a million things you should do if you catch someone who has supposedly stolen from you, this guy decided that he was going to rape her and rape her to the tune of 200 cedis per hour until he has defrayed his cost. Now, he didn't do this in private. Members of the community stood around. Some of them filmed it while he did this to a child here in Ghana. This story, I don't know why it's so quiet, Blessed. I don't know.
Well, I've personally seen some of the pictures online. Not a good story. And what's satisfying is that we've seen a swift action from state prosecutors and
what about the people in the community?
We should be tracking them. The gender minister, I believe, and her team would have to do a bit more to find out. Even those who
the
have the
police and their team.
Yeah, I agree.
Should be doing more.
In terms of child protection as well, I also believe that we could track, some of the devices that have the videos, and possibly if we could just take that down.
It's a horrifying story.
That would be much more helpful. The Overseer newspaper is here this morning. CD at 60, handle CD with pride. That's according to the finance minister. Government is now introducing a state-led Ghana Health Information Management System to replace that of Lightwave. So that is the new position of the government of Ghana on this whole health information management system, and the health minister has been speaking extensively about that. NHI CEO declares war on illegal co-payments, vows to restore trust in Ghana's health insurance system, and top NDC executive in Adenta implicated in job recruitment and fraud, as well as extortion scheme. So these are some of the stories you'd find, as well as the commendation going out to the public from the Public Accounts Committee, actually, to the Mineral Investment Fund CEO for honesty, competence, and institutional reforms. kudos to the team there at the Mineral Investment Fund. So these are some of the stories that you'd find when you grab these newspapers this morning. I think we should do myjoyonline.com, because myjoyonline.com is talking about this interesting story regarding the anti-LGBT bill. There's an MP, Member of Parliament for Ho West, the Honorable Emmanuel Kofi Bedra. He says that if the anti-LGBT bill is not passed, I won't return to Parliament. So that's his assurance as a way of contribution to, the strong belief he has in the fact that there ought to be family values and that this LGBT bill ought to go through. In fact, the Speaker himself says he disagrees with the President on how this should be treated, and they believe that, well, let's just restart the process in Parliament. The government says they want to be in control over the anti-LGBT bill. Moses Foamoining is back in the news. He's back in the fray. He's urging government to take over the anti-LGBTQ legislation as a public bill, and he wants that done immediately. Show up to work or risk your seat declared vacant. That's a warning from the Speaker of Parliament, because at the start of the sitting, you would see quite an empty chamber. Notwithstanding the fact that one side has 2/3 majority.
It happens all the time. All the time. What else? What else is occupying the attention of majority of parliamentarians besides being in Parliament? What else?
It's crazy.
What are they doing? Where are they?
I wonder.
Now, I understand if a minister can't be there because of the duties of his ministry.
Yeah.
But what about the rest of them? The teeming, sweating rest of them. Where are they?
Where are they? That's the big question. Anyway, over 120,000 national service personnel have been they've received their allowances for multiple years. That's according to a forensic audit report, and it's just flowing from this whole Gifty Owari and the former NSS boss case. Lots of revelations coming through in terms of what the prosecution has been saying. But all I would say is the new management ought to take some steps to tighten the system in terms of how loose it is, because if according to the fourth estate, foreigners can get onto the payroll for NSS and overaged individuals, and people above 60 can still find their way as volunteers or NSS personnel, and then that's not a healthy system. We ought to improve it.
It bothers me that in spite of the size of the scandal, we haven't seen any action to reform how things are done at the NSS.
Precisely.
Nobody is doing any work to actually plug these holes to ensure that next guy can't do the same thing. Right?
At least we understand there's a new system they're rolling out. A new system, but we're not sure. Probably unless it's tested.
Yeah, but isn't the testing of it? Doesn't it involve us knowing what that system is?
Yeah, I think.
Yeah, that's step one.
I think so.
Yeah, because if someone else comes and builds in some other clever way, some other clever backdoor, to steal from it, we have to be able to test the thing robustly, right? This falls under what? Youth ministry, right?
Yes. Yes. Pablo and his team.
They should be taking some leadership in ensuring that this thing is done openly, honestly, transparently. We can all look in and see what new system is coming to ensure that somebody doesn't come and do this to us again.
Yeah, that's right. Anyway, City Newsroom Online. This whole traffic safety issue is coming up again, because air traffic safety engineers, they've suspended their planned strike. So some good news coming through there. Yesterday, in fact, lots of people were worried as to what this will mean for flights. Looks like the Ghana Civil Aviation Authority has been able to work out something. So that's a good news coming through. I just hope that the workers won't disappoint us. Whatever the case, please deal with that quickly and get back to work. Edubwahin trial, I'm disappointed, not discouraged. That's according to Samuel Atacha, who's the lawyer for the former national security couple. He seemed really down-spirited when he came from the Supreme Court yesterday. I've seen the visuals.
What happened at the Supreme Court yesterday to make him down-spirited?
He didn't seem too happy because they were trying to injunct the process. He had some issues with the judge, I think at the High Court level, so he was hoping that this will go his way. But looks like there was a unanimous I don't want to say FC, but a unanimous decision actually setting, which is now throwing away all of these.
I would never know
now,
where that term came from. Unanimous FC.
Yeah.
What does the FC stand for?
Functioning club or football club.
Yeah, but what has football club got to do with unanimous decisions?
It's just it's just a unique way by which you have all judges thinking alike. That's the beauty of it.
Yes.
So you want to group them as a club.
Oh,
Yeah,
that's what it
yeah.
means. I couldn't wrap my head around it. Unanimous FC.
Yeah, FC.
Like why?
Yeah.
Okay, all right.
Just like Kojo Yankson FC.
Yeah, what is that? All right.
Okay, Nana Kunidu was a strong-willed and fearless person, even as a child. That's according to Fritz Barfel. Oh, it's refreshing to hear from Fritz Barfel.
Yeah.
Barging MPs who fail to attend sit-ins will now risk losing their seats. As for this one, he said it so many times, but the MPs always have a clever way of, finding their way around it. Because I understand if you absent yourself for a number of consecutive days,
you are automatically out.
Yes, so they find a way of breaking that and find a way of asking permission for one or two things, and they could use that to stay away for a while. But you never know. Let's see. Maybe now the speaker will crack the whip. Recent African elections, a mockery of democracy. That's according to Dr. Asah-Asante of the University of Ghana. As for the elections we're having now in not just West Africa, but across the continent, it appears that would have to create an independent African election body to supervise elections.
We are just a continent of settings, settings upon settings, and we are all living in it, openly aware that this thing is. I mean, we are lying to ourselves, but we are okay with it. We just don't want. We are so scared of change. We're so scared of change that we are willing to just continue to live under tyranny forever.
My goodness.
Yeah.
Okay. So now the indication is that government will now be introducing the Ghana Health Information Management System.
GHIMS.
Yes. Instead of the
we like abbreviations,
and all of that.
GHIMS. Yeah,
that's the new one that will be rolled out because the Minister for Health, Kwabena Mintah Akandoh, has now announced the establishment of a new digital health platform. That's the Ghana Health Information Management System aimed at overhauling the country's national health data infrastructure. So that's the new announcement coming through. Currently, only 450 of the country's 950 health facilities were connected under the previous system, which was supposed to be for the Lightwave Health Information Management System. But now he says that going with this new approach, they'll create an interface. If you're a service provider and you want to connect more of the hospitals, you plug in. That will be the new interface.
So different people will come and connect different
to
hospitals.
Our setup, our infrastructure.
Differently. So okay.
No, so what is happening is there'll be a central pool. You connect into it if you want to provide services for, say, 200 hospitals or 20 hospitals. Now there won't be monopoly over the data, right? So if you want to provide a service, say in the Ashanti region, and you're giving that contract, government will then already has the infrastructure with the GHIMS. You get to plug in and provide your service.
Okay, I mean, this is just me attempting to run my mind around this solution. Okay, so we could potentially have a situation where, say, in the Volta region, your company is integrating all the hospitals there. Then my company is integrating all the hospitals.
But then there'll be a central
OT region, right? But they are connected.
Yes, through a central system managed by government.
So that if someone comes to a hospital in OT region, they can still see their records from the Volta region,
precisely.
Right? Okay, good. All right. But what it also means is that you have access to the Volta region data, right?
It should be.
And I have access to the OT region data, right? Which means that you can still hold government to ransom. And say that, well, if you don't pay me, I'm switching off Volta region.
So his point is that's what he wants to avoid with the central pool, where everyone is just plugging in. And when you pull out, there's still the system, the infrastructure that holds the data.
Okay, so having multiple players, I don't think that is what is solving the problem of someone not being able to hold us to ransom. I think what is solving that problem is the fact that they now have this interface system. So it could still be one person
Well,
providing the whole service across the country, as long as that person has to go through an interface, that means that they don't have control of the data. That is what my mind is telling me is the actual solution, the interface, or whatever they call it, the midware, as they call it.
Sure.
Right? Okay.
Yeah.
Anyway,